For my disclosures, I do invest in a number of surgery centers, but otherwise nothing relevant. We all know that total knees are a very successful procedure, and it's come a long way. Obviously, you're seeing some great technology, some robots, some great techniques. Really, the final frontier is the enhanced recovery to the point where we can now do these as an outpatient. I remember when Brian and Michael and I were at Mayo and rounding on our patients were in the hospital for 4 to 5 days back in the year 2000. My practice in Denver, we got our length of stay down to 1.6 days, and recently we've been doing predominantly all these joints as an outpatient. So yes, it can be done. There's a lot of critical components, and surgical technique is one of the factors that can enhance recovery. So let's talk about tourniquets and how this can affect your pain and function. Back in 2010, there was a survey done of how many surgeons use tourniquets. How many surgeons here use a tourniquet routinely? How many routinely don't use a tourniquet? So obviously that trend is significantly growing, about 50%. So have any of you in the audience ever tried a tourniquet on your own leg?
Yeah.
Yep. What pressure did you put it up to? 300. David?
250.
250. And how many minutes?
Hurts like 2 minutes and I was done.
Yeah. So I had a stopwatch. After 10 minutes, it was absolutely intolerable. And the next day, I had trouble walking up and down stairs. So there's definitely some pain that's involved. So after that, we started studying this. And obviously with tourniquet, there are some advantages. You have better visualization, perhaps better cement technique, and a questionable reduction in blood loss. But obviously some significant disadvantages. DVT risk, neurovascular injury, perhaps increased infection risk because of reduction of antibiotic circulation. So there's been a number of studies, but the purpose of our study was really to focus on post-op quad strength and to evaluate pain.